We first met whilst at a networking meeting for a suicide prevention fund that we both got some money for, and I think the first thing that struck us both was just how similar our kind of core values are and our shared interest in supporting vulnerable young people in the breadth of the work we do. So I think when we kind of met each other and we knew what each other were doing, there was definitely a lot of work that we thought we could identify and do together. And then when we did come together to have that conversation and we told you about the service users that were currently awaiting our support or going through our support, it was just the perfect opportunity from our perspective as well. You know, we want to get young people into levels of support that's not just talking therapies, but actually getting young people into activities that we know are really good for wellbeing and mental health.
Teaming up with other organisations and working in partnerships, absolutely massive for us. Obviously we're standalone, we're in a particular building that's got joint services in here. Obviously we've got a range of climbing and activity, but working with people that are expert professionals in their fields, absolutely massive. For me, it was all about, we were already supporting adults through holistic approaches through climbing, and we had young children covered as well with another project that we were delivering, but where we were missing was the 12 to 17 bracket, and those kids are really struggling at the moment, particularly with everything that's gone on with COVID. You've got social media, you've got so many interventions and distractions with young people. But what was important for us is we're good at climbing and we're good at working with children and young people, but what we're not is mental health experts, but actually you guys are. So it was about combining both of those, you know, drivers, if you like, to say, well, yeah, we'll work with you to work out what your problems are, but then what you'll do is you'll go and climb and you'll test yourself, you'll abseil, you'll go up a high wall, you'll go in a dark cave, and you'll explore what positive fear feels like. And you'll also understand what it feels like for your mates to say, oh, try and get a bit higher, and that elation when you feel like you've done it. And it's about that challenge and somebody overcoming something that then they can translate into their everyday life. And I think it'd be nice to revisit that at some point and see how these kids are getting on after they've done our project.
Yeah, 100%. Yeah, I think rock climbing brings together many young people. We don't have to specifically think about young people with particular issues. So we don't have to bring 8 kids who are all struggling with low-level anxiety. When we get here, rock climbing is so useful and therapeutic for children struggling with a range of issues. So for example, children struggling with intrusive thoughts and then, you know, low-level suicidal ideation, having suicidal thoughts, they can't think about anything else while they're here because they're up on the walls, or they're belaying, or they are motoring, or they're supporting their team, and that gives them 2 hours of respite from what's been, you know, struggling in their head basically. So it gives them that headspace, it gives them that respite, and that's really effective. For someone who might be struggling with social anxiety, it gets them out of their comfort zone, it gets them into a safe space, gets them speaking with other people, boosting their confidence, their self-esteem, their social skills, socialising with other people as well who might be struggling with other issues. So there's so many different things that rock climb can bring out in people, and we have definitely seen that in some of the young people that have come through the programme so far. And yeah, we're just really excited and you know, really excited about what the future holds in terms of that, and how we can potentially target specific issues and also do some psychoeducation and mental health intervention alongside that rock climbing, and trying to, you know, unpick what they've gone through while they've been up on the wall, I suppose.
I think what makes this partnership unique is that we've taken what our offer is, active urban adventure, and then we've really combined it with your sort of you know, mental health intervention. So what I was struck by the other week when we had those young kids in that came to see us was that we did the session with you guys in here and sitting and observing how you guys work. There's your stress bucket, this is how you get more and more stressed, and actually this is the sort of thing that you can do to reduce the stress and turn the tap at the bottom of the bucket. That really struck me as an adult, and actually seeing the kids' faces and going, oh yeah, that makes sense, I'm going to be using that later. But then combining that with a little bit of fun afterwards, testing themselves on the walls, testing themselves on the abseil. It's that real holistic approach. It's saying, this is what your head's telling you and this is what your body's doing. Let's combine the two and make you feel better. So that for me is why we're doing it slightly different. And I think also the kids, they're more receptive to what you're saying and what you're doing by being in an external environment, by doing something different. We've got a broad agenda to support physical and mental health across all ages, but that's a very broad spectrum. We are expert in our climbing and we do work with vulnerable adults, but actually we need to work with guys like you to really understand the mechanics behind mental health and how we can support it properly. And then we provide a really lovely holistic approach. What we've found with people that have come through our doors is that they've said, when we're in here, we're not being judged, we're just here to climb, and that's absolutely massive.
I think young people coming here, they feel like it's a safe place and they know they're coming here for rock climbing, but actually they're not just doing that in a mindless way. We're actually getting them to actually practice a bit of mindfulness, understand what feelings, thoughts and emotions they're going to feel. First time going up a climbing wall, I'm sure if anyone who's going to be on a climbing wall, you are a little bit scared and nervous to start with, but it's about embracing that, understanding and reflecting on your emotions and not being scared or overwhelmed by them, and manage them in the right way. Working with the ROKT Foundation, what we've really loved is that it's just been so easy right from the start, and I think that is because we share so much in terms of values, what we're trying to achieve and what we're trying to get out of young people in Calderdale and beyond. I think we're both creative organisations, we're both very open, honest and transparent, and I think we both understand what our strengths are, and we really try and work towards that. So we know you guys are the experts in rock climbing, we know you guys are fantastic at getting young people here on site and supporting them, and then we try to bring that mental health expertise and our young people that have come through our services who we already have a prior relationship with, and I think those two things married up just make a fantastic partnership, and I really truly believe that we're getting such fantastic results from young people who have not been to services or have found it difficult to access mental health through statutory services, for example, and now they're coming here, they're getting support from Invictus, but they're also learning new skill, meeting new people, and having a fantastic time rock climbing as well.
What we really enjoy about working with Invictus Wellbeing is the fact that you've got so many established connections in communities already. You're not only expert professionals in your field of mental health and supporting children and young people, but you're already doing a lot with other organisations. So Healthy Holidays is happening, you're working with Halifax Panthers, you're working with the Community Squash and what have you, and seeing how you branch out, very similar to the way we want to work. You're not precious about anything, you just want to do more and do it better. So that's what I really like working with you guys because of.